people are actually getting ready for this. They're not going to get burned like last time. I think you'd see massive resistance to public masking and lockdowns. You're going to see people power through this. When I was in a Red Deer, I met some of these truckers. I didn't realize how huge these men are. They're like giants. And these guys are really fighting for freedom. They're all standing up for their rights. One by one, we're seeing them prevail. I think this Canadian darkness of slipping in to authoritarianism, totalitarianism, I don't think it's going to fly. I think Canadians have a lot more backbone than people give them credit for.
We got Dr. Peter McCullough. Thank you so much for being on the show.
Thanks for having me.
Hot back from Canada. In fact, Red Deer, Alberta.
Did you see how packed that auditorium was? It was amazing. The Canadians came out. I was so honored. It was a great program. We are led off by Joseph Borgard, who wore his classic signature red golf cap and got people fired up. We had the national anthem sung, both the American and the Canadian national anthem, and I couldn't believe I was on stage with Jamie Sally, who had won the Olympic gold medal in paired skating as well as the world championship, and then Theo Fleury, Olympic gold medalist, but also Stanley Cup on a Stanley Cup winning team. What a great night it was.
Yeah.
Can you tell us a little bit about what you spoke on, what you shared with the Canadians there?
They took me through a structured interview. They asked me a lot of questions, about many aspects of the pandemic. It was very efficient. We had a lot of doctors in the crowd, which was really great to see. Roger Hodgkinson, William Mackus, so many of the Canadian heroes. They were on the front row, acknowledged. They were the doctors that were bringing Canadians the truth from the very beginning through the pandemic. And Sally and Fleury took me through a structured interview. I asked their questions, and tried to be as informative as possible to the group. The Canadians are, still trying to figure out what in the world happened. How come early treatment was crushed in Canada? Why were they denied compassionate care? Why were the vaccines, rolled out? And before we knew it, the vaccines became essential to freedoms in Canada. Why was that tethering put in place? Why did people feel so uncomfortable taking shot after shot? And then what has it resulted in terms of health of the Canadian population?
Yeah. Did you also deal with the questions about Trudeau's attack on particularly the natural products, helping with natural health?
We didn't cover it, but it's come up on so many interviews. It's happening in the United States as well. There's a sweep on over-the-counter products by the United States' Federal Trade Commission. Canada will be another similar authority. But it almost seems, Allan, that there's an attempt by government authorities to take away over-the-counter options to people, to make them feel almost more dependent on taking another vaccine shot.
Wow. Yeah. That to me is very dangerous, don't you think?
It's worrisome. People want to control their own medical destiny. There's a big pushback against big pharma. Trust has been lost in big pharmaceutical companies, largely through the vaccines and other nefarious activities, as well as government authorities. People at least want to be able to purchase various forms of nutraceuticals, other products, over-the-counter pharmaceuticals, and manage themselves. My response to the interviews are, listen, if this review was for safety and certain agents were being removed for safety concerns, so for instance, pseudoephedrine and phenylephrine, those products have been related to high blood pressure and problems. If they're removed, I wouldn't mind it. But there's so many other over-the-counter therapeutics, for instance, Benadryl or diphenhydramine, chlorpheniramine, all the other antihistamines. We use them. We rely on them, topical hydrocortisone. And now we've cracked the code, we believe, on detoxification after vaccination. So we're really reliant on over-the-counter products there.
You did crack the code?
We did. We had a breakthrough publication August of 2023 in the Journal of American Physicians and Surgeons 3 substances now combined. Our clinic actually combines it into a single capsule. You can buy them separately. Clearly work to begin to break down the spike protein from the vaccine and from the viral infection itself, clear it out, reduce inflammation. People are getting better. It takes a while, but those substances include nattokinase, 2,000 units twice a day, bromelain, 500 milligrams a day, and curcumin, 500 milligrams twice a day. And our clinic has what's called McCullough protocol base spike detoxification, which is 1 capsule taken 3 times a day in between meals. Wellness company, I advise them as the chief scientific officer. They offer the trio that's just been offered. There's several offerings now on Amazon, local pharmacies. How this works is that the nattokinase, which is a natural fermentation derivative of soy, the Japanese have been using this product now for several decades to actually reduce atherosclerosis in blood vessels. Nattokinase clearly dissolves and breaks down the spike protein. The spike protein from the virus, by the way, has been found in tissues and organs. It's in the bloodstream for 6 months, and people have taken the shot. The spike protein is bad news. We've got to get it out of the body. Nattokinase does that. Bromelain came along. Bromelain is a family of enzymes derived from the stems of pineapple, also well tolerated, taken in between meals. That dissolves the spike protein a little different, proteolytic cleavage joints. And then curcumin works to reduce inflammation generated from the spike protein. That's been shown even in human randomized trials. So those 3 together, we think, are a base. Now, other things can be added. I've worked on this for 4 years, so there may be certain syndromes where I'd add hydroxychloroquine or ivermectin or corticosteroids or colchicine, other various drugs. But the base, the nutraceutical base, people can buy this over the counter. Those with long COVID, post-vaccine injury syndromes, people have just had multiple shots and are worried. Base spike detoxification, it is really now the chatter on social media. It's the first published approach, a detoxification approach. It's interesting that once I had it published, I had it through the peer-reviewed literature, and it's available online. It's actually on the European Commission server. It's got record downloads. As soon as I had published this, immediately there was crushing pushback and censorship. And the messages were, Dr. McCullough, you can't do this. I was like, it's the same censorship I received when I published the first treatment protocol for COVID. I was like, what do you mean I can't do this? Well, you don't have enough evidence. And immediately people, didn't want anybody to get any therapeutics. We're right back to the same issue.
Why are we still jabbing people? That I don't understand either.
And where's the evidence of that? Shouldn't they say there's not enough evidence on that? But for you, they could say it.
Oh, there certainly isn't. On the vaccine front, it's been a tidal wave of bad news. Now we realize, paper by Michaels and colleagues, a forensic analysis of the data from the Pfizer trials program. Pfizer had 38 additional deaths in their program from the time of the data cutoff mid-November of 2020 to the FDA meeting December of 2020. And sure enough, more deaths occurred in Pfizer. And when the committee met to approve Pfizer, it turns out Pfizer had a 3 to 4-fold increase mortality risk. And nobody on the committee asked for the additional data from the data cut point. The Pfizer didn't volunteer it. I've been on these FDA panels myself. I've advised the companies. We always give an update for the briefing booklet and the core slides from the time the data cutoff and the submission to the FDA to the presentation. They didn't do it. It was concealed. So it turns out Pfizer never should have been approved. Moderna never should have come out, neither AstraZeneca or Janssen. And this whole thing became a tidal wave. Now there are multiple calls. World Council for Health in 2022 said, get them off the market, pull them. Association of American Physicians and Surgeons 2023, pull them off the market. I've had that in the National Archives now in the U.S. Senate. I've made the call. I've multiple state senates, and now I've made the call in the European Parliament, September 13th, 2023. Someone's got to make the call. Pull them off the market. They're not safe for human use.
And yet we continue to see it happen. Dr. Judy told us that the new technology of the protein, spike protein in vaccines are now in all vaccines. Is that correct?
No, the messenger RNA technology is planned to be the backbone biotechnology for all vaccines in the future. Moderna's got dozens and dozens of them. But I can tell you, I don't think any messenger RNA vaccine is going to be safe. So
Right.
you can take a flu shot, which is relatively safe, but it doesn't work right now, and make it a messenger RNA flu shot. I think we're going to make it unsafe. And the same would be true for pneumococcal vaccine or any one of these others. So messenger RNA itself ought to be suspended as a platform. It's not safe because what it does is it makes human cells start to produce abnormal proteins, and then the body attacks itself. And so it's going to happen for every single messenger RNA vaccine. And to make matters worse, it looks like it targets the heart. I think this was unexpected. Messenger RNA targets the heart. A recent paper by Schreckenberg and colleagues from Germany show that virtually everybody who takes a shot, their cardiac PET scans, positron emission tomography scans, turn abnormal in a diseased pattern. I've never seen this before in my career. And then on top of that, Crossan and colleagues from Harvard have published that the messenger RNA is physically in the heart, the human heart in people who die. The spike proteins produced there, it causes damage. Same thing is going to happen with an influenza vaccine. It's going to basically be cardiotoxic. So I'm calling for a ban on all messenger RNA vaccines. Right now,
Mm.
the COVID vaccines, Pfizer, Moderna, are the only messenger RNA vaccines. The other ones have not come out yet, but boy, the companies are really chomping at the bit to get this new technology out. I think it's unsafe and unwise to do so.
Well, you're talking to our Canadian audience on Daystar, and just a little while ago, you were on the American Daystar with Dr. Tess. And
Tess Lowry, yeah, from the UK, everyone knows Dr. Tess. Boy, isn't she pure class?
yes,
She
she
is.
is.
She's got to be one of the classiest ladies out there. Bath, UK, former very high level advisor to the WHO. She's formed the World Council for Health. Everybody in Canada ought to go check out their website. World Council for Health has got a pink and yellow background. They have the best collection of policy statements, analysis, press briefings. And she updated us. This is really stunning. September 5th, 2023. Go on their website, you'll find it. World Council for Health is now calling for a moratorium on all childhood vaccinations because the panels have installed the COVID-19 vaccine in the schedule. And this is a clear message that the vaccine panelists, the people on these deciding panels, they don't care about childhood safety. And so now there's a great concern that this ever accelerating, intensifying, multiplying vaccine schedule could be harmful, particularly the vaccines all given in combination. Do you know at 15 months, there's over a dozen different vaccines that are given to the child at the same time, many in combination products. We're worried about febrile seizures, all kinds of problems that are developing, and it's not looking good. The more and more safety data that come out on the routine childhood vaccine schedules, it's not looking good.
Yep. We have Dr. Makis on the show a lot. You were just recently with him in Red Deer. He is cancer. Like it is spiked like no other, according to his study. Are you seeing the exact same thing too? Is cancer just going crazy? What are your thoughts on that?
I talked to a prominent pathologist, Michael Robles, in Dallas yesterday, and really a long conversation. He says he's never seen so many aggressive cancers on biopsies, even colon polyps that look far more aggressive, neoplastic changes. I published the first bona fide case of COVID vaccine-induced cancer. Anthony Karagopoulos is the first author. It's a Greek man, and he took the vaccine, developed a basaloid cancer in the temple area. It just invaded the facial nerve, the trigeminal nerve, invaded the brain and killed him. And we carefully document this with all the pictures, and we've made it clear the vaccine caused this cancer. Now, the question on the table is how many more out there is the vaccine promoting cancer, and under what mechanisms? We don't know. This is very disconcerting. The vaccine has proven safety signals, and the regulatory agencies agrees that the vaccine causes heart disease, neurologic problems, blood clots, and immunologic problems. I can't imagine a product that also causes cancer. But the mechanisms for cancer are the following. First is the S2 segment of the spike protein, which is installed in the body from the vaccine. a modeling study by University of Pittsburgh, Singh and colleagues, inhibits P53 and BRCA tumor suppressor system. So it inhibits our ability to fight off cancers. The second mechanism, and Chinese have shown this, that messenger RNA probably inhibits DNA repair. So we can't repair our own DNA when a mutation occurs. And then lastly, this breaking news from microbiologist Kevin McKernan, David Spiegler from Canada, David Wiseman in the United States, about 12 labs, Dr. Buchholter in South Carolina. This is now clear. The vials appear to have process-related DNA impurities at a higher concentration than we expected in some of the vials. The Spiegler paper shows it's related to adverse events. What we know is the companies switched from making pure messenger RNA into a E. coli-based method. So they use bacteria that contain little replicative circles of DNA called plasmids, and the plasmids have an antibiotic-resistant gene on it, and they have a promoter sequence. This is very worrisome, called SV40. SV40 has a promoter enhancer and what's called an origin of insertion. This is a known cancer promoter. Now, it's used artificially to cause the DNA to multiply that's coding for the RNA. So it's used intentionally, but they found SV40 in the vaccine vials. This is not looking good because this is a known cancer promoting DNA sequence. So in a paper by Anguis and colleagues, which I've cited on my Substack, they basically have concluded that, listen, the COVID-19 vaccines have fulfilled the multi-hit hypothesis for oncogenesis, meaning at least in 3 different ways, it looks like they could cause cancer. And Sutherland and Baylor in 1984 published the multi-hit hypothesis for cancer-promoting substances. The vaccines fulfill those criteria. Now we have to be on the watch, I think, for the next 5 years, and anybody who took a shot looking for an increased risk of cancer or cancer recurrence.
Does that even include, like, we follow pharma, big pharma, and like they are now really hyped on RSV shots, and now they're all into like cancer shots. Like, they're all getting into the cancer game for a vaccine, to help with cancer. What are your thoughts on that? Because it seems strange to me that that's what they're all excited about now. I mean,
I think cancer vaccines are off in the future. There was one vaccine that makes the claim it can reduce cancer ecologically, and that's the HPV vaccine. But the concerning thing is this vaccine mania. For instance, RSV, which is not a genetic vaccine, it's a fusion protein antigen-based vaccine. Do you know it's being given to 3rd trimester mothers to theoretically give immunity to the baby? The RSV vaccine is given to infants, and monoclonal antibodies now for RSV are given to children on the day of birth. RSV is a ubiquitous virus. It's kind of like the common cold. Recently today in Dallas, Cook Children's Hospital announced that 30% of everybody they test has RSV. So it's basically everywhere. It's not something you'd have a vaccine against. Because we treat it with simple nebulizers, albuterol and budesonide nebulizers. So you can just see that somehow people lost their mind on vaccines, and these are very much unnecessary products. But by the way, for children, 5 studies, Mawson, Hooker, Miller, Thomas, and an older Amish study, show that going with no vaccines at all in the modern day, it's actually safer. There's lower rates of neuropsychiatric diseases like autism, attention deficit disorder, Asperger's disease, seizures, need for tympanostomy tubes, allergic dermatitis. The kids actually do better with no vaccines because we don't have big threats of pertussis or diphtheria or these other illnesses. And not only that, but we have antibiotics now that can treat so many of the illnesses if they develop.
So after all this time and all the interviews you've done and everything you've written and everything that's going on, do you feel optimistic of what's coming in the future, or do you feel pessimistic?
No, I'm optimistic on 2 fronts. October 5th, 2023, AP and Reuters announced only 1.3% of Americans were taking these new boosters. I mean, it's a tiny fraction. I'll go with that estimate for now. I think very few people are taking them. The message has gotten out. Again, we have now two evidence-based, consensus-driven organizations, one in the UK, one in the United States, saying pull them off the market. We're seeing lawsuits all over. Oh my Lord, there's just so much legal activity now with the safety disaster of the vaccines. But the reason why I'm optimistic is Canadians and Americans are so much better prepared for a next pandemic. Remember, Tedros at the WHO, Fauci, who's still a major board member and advisor at the WHO, Hotez down in Houston, and Bill Gates. They all say there's going to be another pandemic. The experts believe it's going to come out of another bio lab because all these labs are all over the place working on these infectious viruses. It'll probably be like COVID. So we've learned that virucidal nasal sprays and washes, everybody should have an iodine or xylitol, colloidal silver-based nasal spray. Everybody should have scope or Listerine or similar to gargle with. You can supercharge everything with a drop of iodine. I mean, that's the best early defense. Somebody coughs on you, you're worried, do the nasal spray and gargle, have it ready, do it every 4 hours as soon as you begin to get sick at all, because the viruses go through the nose and mouth for about 5 days before they invade the body. Wellness companies got a wonderful emergency kit at home you can have. People are actually getting ready for this. They're not going to get burned like last time. I think you'd see massive resistance to public masking and lockdowns. You're going to see people power through this. When I was in Red Deer, I met some of these truckers. I didn't realize how huge these men are. They're like giants. And these guys are really fighting for freedom. They're all standing up for their rights. One by one, we're seeing them prevail. I think this Canadian darkness of slipping in to authoritarianism, totalitarianism, I don't think it's going to fly. I think Canadians have a lot more backbone than people give them credit for. I really felt the spirit when I visited Canada. I hadn't been in Canada in 4 years, and my wife is Canadian. My kids are Canadian. I haven't been in Canada in 4 years, but I got in. There wasn't a problem. It was all electronic in Calgary. It's not like when I went to Australia. Myself and Corri, we were kind of roughed up at immigration, so they were waiting. They were waiting for us. But no, Canada. I came in. I presented the data fairly. It was well accepted, and I feel really good about the visit. Really happy I went.
Well, we're glad you weren't roughed up. That's good.
We just interviewed Dr. Corri about shedding. He's been doing a lot of research on shedding and what's happening there. Fascinating stuff. And, well, we appreciate everything that you're doing. How's the wellness company doing in Canada? Because I know you guys are live in Canada now.
Yeah, Wellness Company has a Canadian board, Macus, Hodgkinson, Alexander on the board. They clearly are making strides. It's a little different than the United States, but they're making strides. Remember the founder of Wellness Company is Foster Colson. Remember Colson Aviation out of British Columbia. So Foster's committed to bringing solutions to Canada. Canada is so much different than the United States. The geography is so big. Population is sparse, kind of centered around these cities. But I'm convinced we're going to provide solutions. Europe needs solutions as well as so many other places around the world. People know something went wrong during the pandemic. They know that they were intentionally deceived by the governments. People now know the vaccines are not safe. They're not effective. And they're going to be looking for early treatment solutions, which that's where I was at the very beginning. Treat early. Fortunately, COVID is so mild right now. We just use the nasal sprays and gargles, rarely have to use any drugs. Let's cross our fingers that we're going to get a period of time of recovery here, and let's get battle ready for the next pandemic.
Yeah, agreed. I remember you on social media right in the middle of the pandemic, treating people with ivermectin, and you were like close to face. You weren't afraid. Yeah. You were out there facing it head on. So we appreciate everything you're doing for the United States, but also for Canada and the rest of the world, because you are everywhere. You're everywhere I look, you're on TV.
Well, there you go. Make sure you follow me now. My website, petermcculloughmd.com. That'll take you everywhere. My leading podcast, America Out Loud Talk Radio, McCullough Report, Courageous Discourse Substack. Get the graphical abstracts every day. My book, Courage to Face COVID-19.com. Now you need to get it since it got targeted for being banned from Amazon. Sales have skyrocketed. But the bottom line is I am committed to bringing the world the truth. And I'm not just a critic. I'm bringing the world solutions and it's my duty to do so. It's my responsibility to do so. And, it's my right as a medical authority to do so. And I'm going to be bold and I'm going to be relentless. I can't be stopped. So great to be on with you guys.
Thank you.
Appreciate you. Thank you so much.